Hi, Dr. O'Flynn here. I'm here to give you a talk on my personal health span investment portfolio, or as I like to say, my other hip. And my health span investment portfolio will all be revealed in this talk, giving you an insight into what I actually do to try and improve my chances and my investment of hopefully getting a healthier end of life health span. So, do we have any conflict of interest in this subject? Absolutely. I have an active interest in improving my health span. And yes, I declare a conflict of interest here. And hopefully, you will get to understand as this talk goes on as to why. When people consider a pension plan, they often get in touch with their broker and they go through the options of HIPs and SIPs and ISAs and how can I manage my pension. And it's a real effort of time and money, of course. Some of the efforts look at low risks, moderate risk investment, high risk investment. But I feel that we've missed out on something here. For example, you can get to the age of whatever you're trying to get to, and you've got all that money and your pension's ready to go. But in some cases, you might say, hey, why didn't I invest in my health? I've got the money, but I don't seem to have the health to be able to enjoy it. So this is where I think the investment in your health span comes in. And this is what we're going to talk about today in this talk, my hip. And I will be revealing what's in my portfolio in the hope that it will stimulate you to start investing in yours. Investment in your hip ideally should start at 45 years of age onwards. Me personally, I started, I think, at around 55, so I've been going at it for a number of years now. And your broker should be hopefully showing you what the options are and tailoring, as in any pension plan, tailoring what might be achievable for your given circumstances and what might be the best investments for the returns. So health span and lifespan, health span versus lifespan. So what is your health span and how do you measure it? Well, the health span is that part of your life that towards the end of your life that you should be spent in good health, hopefully. So health life expectancy has increased over time, but not as much as life expectancy. So more years are spent in poor health. For example, a male in England could expect to live up to almost 80 years in 2018, 2020. His average healthy life expectancy was only 63.1 years. So that would mean he would have spent approximately 16 of those years in not good health. Similarly, a female in England could expect to live to 83.1 years, of which approximately 19 years would have been spent in not good health. And although females live an average of 3.7 years later than males, most of that time again is spent in poor health. So I'm going to take you through a number of different topics now, which are the basics of what I use in my hip, as I say. And the first one we're going to talk about is FMD and diet, and diet in general. FMD means fasting mimicking diet. So for the last 10 years, I have been doing a fasting mimicking diet. That's an FMD in scientific terms in Brazil. And I do this every 6 months, and it's simply a 7-day, 800 calorie fast based on coconut water, herbal teas, and vegetable soups. As I say, I've been doing this for 10 years, and I think this is really important for tool in my health span investment portfolio. So what does that do? What do we achieve with such an investment? Well, one of the things is increased stem cell activity. Another thing is increased autophagy and mitophagy, increased senolytic activity, decrease in inflammation, weight loss, of course, and improved insulin sensitivity. We did our own research on stem cell activity in this particular retreat diet, the FMD that we did in Brazil in 2018. where 5 of us had bloods taken a week before, a week after, and 10 weeks at the end later. And all of the test results came back showing exactly the same thing. They went to Professor Steve Ray in Oxford, who is a stem cell expert, and it clearly showed that our stem cell activity had gone up by 20% for the 10 weeks afterwards. That was a pilot study, and hopefully down the line we will do further study. But to me, that was a very important finding. Also, of course, what happens is an increase in autophagy and mitophagy, and these effects last, including senolysis, these effects last for up to 2 to 3 months after the fast. So the benefits last for a number of months afterwards. What is senolytic activity all about? Well, that's about senolysis. And so when you go on an FMD, your body goes into a stressful metabolic response to the lack of food. And one of the things it does is it knocks off the senescent cells in your body. It's a bit like inner pruning of the old leaves in a tree. I talk about inner pruning. And so the senescent cells, which are the cranky, worn out cells that are using up resources, are basically recycled in an effort to gain more energy for the body's metabolic system, which thinks it's run out of food, so it has to be resourceful and maintain its energy levels. Another thing, of course, that happens is an increase in inflammation. So your inflammation levels go down after 7 days of fasting like this. And inflammation is an important thing again as we age. And the new word that's out on the block these days is inflammaging. So your inflammation factor is going down as well. And of course, the other things that we get, weight loss and improved insulin sensitivity. It is a very interesting intervention. I always feel energized for the first 4 to 6 weeks after I've done this fast. It's a fabulous experience, and I'm very lucky to be able to do it in a warm climate. However, this can be done anywhere, and my feeling is 7 days of an FMD, fasting mimicking diet, every 6 months, it should be at the core of everyone's investment portfolio. So benefits of an FMD. It's a very safe intervention for healthy people. Of course, you would avoid it if there's any history of an eating disorder and discuss the options with your healthcare professional. Always easier to do it with someone else or in a group, and always easier to do it in a warmer climate. If you're over 40 or 45, I feel you should fast every 6 months as a maintenance intervention to slow down the whole inflammation process and possibly prevent or delay the onset of cancers, type 2 diabetes, and dementia. We're starting to learn that the gut and inflammation are very important in these long-term chronic illnesses. And again, as I said earlier, always consult with a healthcare professional before making any changes to your diet. So this is one of my favorite slides that I use frequently in my talks. And thank you again, Professor Roy Taylor, that wonderful diabetic researcher in Nottingham. And Professor Taylor kindly lent me these slides of research he did in 2014. And this is the cross-sectional color-coded MRI of a 58-year-old patient that was on 7 medications. At the beginning of the intervention, there was 32% liver fat, and then later 11% liver fat, and then later 3% liver fat. And this is nicely demonstrated by this color slide. This is a cross-section, so it's a cross-section MRI through your abdomen, and this is the liver here outlined. And you can see it's green, and that's 32%. So there's a lot of fat in that liver. And then 4 weeks later, there's 11%, and 8 weeks later, it's 3%. So what has this patient done? Well, simply they went on a 600-calorie diet for 8 weeks. And this is actually what happened. This particular patient was on 7 different medication at the beginning of this intervention, 2 of them for type 2 diabetes. And at the end of the intervention, this patient no longer had type 2 diabetes and also was off all the other medication. So we can clearly see here that this particular case, the person lost 14 kilos over this period of time. And of course, a lot of it was fat from the abdomen. And we're learning more and more that intra-abdominal fat and perihepatic fat and peripancreatic fat is very important in how our chronic illnesses develop. And I think this is a lovely visual study and straightforward explanation as to what can happen when you actually, go to a 600 calorie diet. Of course, it's not an easy thing to do. I'm not saying you should do it, and if you do something like this to address your type 2 diabetes, you must do it, of course, in conjunction with your healthcare provider. But thanks again to Roy Taylor for this fascinating study on reversing type 2 diabetes, which he has shown for the last 12 years that it's very possible. So the next topic I want to talk about is sarcopenia, and that's all about muscle loss as we age and what we can do about it. Movement and katsu are the flavors of the day. Another interesting quote for our friend Hippocrates: that which is used develops, and that which is not used wastes away. If there's any deficiency in food or exercise, the body will fall sick. Absolutely true to this current day from 2,000 years on. So muscle is an endocrine organ, interestingly. That means it sends signals around the body. We lose our muscle mass peaks at around 24 years of age, and then there's a 10% loss up to 50 years. And between 50 and 80 years of age, there's approximately a 30% loss. That's about 1% of muscle mass loss from the age of 50 onwards. So muscle tissue, when activated at exercise, releases molecules called myokines. And these myokines drip into your bloodstream and they reach many organs. This is an area that's undergoing a lot of research as our aging population increases in number. So new discoveries will continue, and there's a high likelihood of therapeutic agents coming online in time. So currently there are about 600 myokines have been spotted, but on this function, we only know about the functions and actions of about 60 of them. So in my hip, my long-term investments are walking. What I tend to do is walking, cycling, katsu, Pilates, and gyrotonic. So that's what I'm personally doing to activate my muscle system to generate myokines, which I believe have a very positive overall benefit. Sarcopenia. Sarcopenia is defined as the loss of muscle mass and function as we age. So in general, we probably lose perhaps on average 1% of muscle from 50 years of age on if we don't do something active about it to prevent that loss. And that's what I want to talk about in this section of the talk. So what can we do? Sarcopenia was classified as a disease in 2016. This is a bit controversial because, as some people say, it's not really a disease, it's part of the aging process, etc., etc. But that's scientists argue about these things, the semantics of these things. I think it's a good thing that it's brought to the fore, as it will drive more education and research on this very important topic as we all age. So physical activity reduces cardiometabolic risk, while physical inactivity increases our chronic diseases risk. And this leads to the idea that exercise-induced muscle contraction must contribute to metabolic regulation and health. And it's now well established that skeletal muscle, which is a release of endocrine factors, and these are called myokines. There's a crosstalk from these myokines between the organs, liver, brain, kidneys, pancreas. For example, there's an interesting molecule called irisin, IRISIN, and that is released when you do vigorous physical activity from your muscles into the bloodstream, and that molecule, irisin, crosses the blood-brain barrier and acts almost as a brain fertilizer. Look it up. There's lots of information on this molecule in YouTube. And irisin is a myokine, and a myokine is the name for molecules that come out of active muscles that go around the body and connect, let's say, your muscles to your immune system, to your brain, as I just said, to heart, etc., etc. So a fascinating area for scientific development in the coming decades. So a number of factors come together to give us sarcopenia. And again, sarcopenia, muscle loss. Mitochondrial dysfunction, again, is something that happens as we age. Altered protein regulation function happens. Increased inflammation, as we discussed earlier, inflammaging. The sedentary lifestyle, just not moving as much. Changing in hormone levels as we age, for example, testosterone levels drop, female hormone levels drop. There is a decrease in the motor unit number within the muscle cells. And there's also what we call altered cell numbers and satellite cells function in the muscles as well. And these all lead to what we call sarcopenia. And this, I think, is one of the main enemies of aging, and something that we need to absolutely get on and do something about. Here's another lovely slide. So we're talking about this image of a person pulling the graph across. And if you see it here, we've got sedentary behavior, cardiovascular exercise, and mixed exercise. So obviously the mixed exercise is the gray one, and that gives us the better results of age and muscle strength. That's what was measured on this side, muscle strength and function, and then as we age. So if we put some effort into this whole muscle system, then we get a result. And you can see it here in sedentary behavior, inflammation goes up, body composition goes down, and insulin resistance goes down, the great driver for type 2 diabetes, etc. Then with someone who's doing roughly some cardiovascular exercise, we get less inflammation, body composition is better, and the insulin resistance goes down. However, if we do the mixed exercise approach, which brings the inflammation down even further, the body composition down further, and the insulin resistance further. And we talk about this mixed exercise in the coming slides. But to me, it's a mixture of blood flow restriction, as in Katsu, Pilates, gyrotonic, and simple exercises like walking. You don't have to, in your 60s and 70s days, you don't have to go running marathons, etc., etc. You can actually keep it down to perhaps 130 minutes of good walking a week with some other exercises such as strength training, but we'll get to that. So I found this slide, which is called the J-curve, which I find quite interesting. And it just confirms that in the older age group of 50 plus, that moderation is the way to do it when it comes to exercise. If you over-exercise, these are the numbers for people who are high-end athletes, Olympic levels, or even just high-end trainers, of which there are many about, I can tell you. Look, they tend to get a bigger number of respiratory tract infections per year than someone who's doing moderate exercise here or normal, more sedentary type lifestyle. So it's interesting to see that over-exercise can affect your immune system, and how exercise can affect your immune system in a very positive way. So this is my current favorite. It's called Katsu. I discovered this about 5 months ago. I have absolutely no economic interest in this system, but Katsu is a form of blood flow restriction, and it's been around for about 30 years. Started off by Dr. Sote in Japan, in Tokyo, when he discovered that restricting blood flow to the limbs, upper and lower limbs, can have a very positive effect. Me personally, I've been using it for the last 5 months now, and I've noticed that my grip strength has increased from 45 to 51, which is quite significant to me. I just do 15 minutes twice a day, 5 days a week, on my 15 minutes on my upper limbs and 15 minutes on my lower limbs. And you can see here, this is the machinery that they have, and what it's doing is it's contracting, it's stopping the blood, slowing the blood flow in, but more importantly, stopping the blood flow out. So when you're in exercise, your hands and veins change color, they get a bit engorged with blood, and that engorgement of blood, etc., is a sort of a stress that happens at the lining of the small vessels in the muscles called the capillaries, and we go into what's called the endothelial lining. And when they're stressed like this, they release substances from nitric oxide to a number of cytokines that again go around your body after the exercise and have an interesting effect. As I say, I've been doing it for 5 months. It's a fabulous thing for people in our age group. You don't have to lift 10, 15, 20, 30 kilos, just 1 or 2 kilos with the Katsu bands on, as you can see this lady here is doing, is enough. And you don't have to do it for hours and hours. It's about 15, 20 minutes, thrice a day, depending on your time. So I think this is going to be a big thing going forwards for the older population. And now that they've managed to put it in a Bluetooth format onto your iPhone with an app, etc., etc., it's just so easy. Still a little expensive, Mr. Katsu, I think, but hopefully with time, prices will drop, like and all these new technologies do. But absolutely, I'm a big fan of this, and I'm prescribe it for my patients, especially people who are trying to recover from surgery on their limbs, etc., etc. I think it really has a place. No, it's never too late to start, and I just threw this slide up here to show you that even nonagenarians can get improvement from physical activity. Some very interesting studies done on that age group, and you can pick this up in the references at the end of this talk. But for sure, from 90 years of age on, muscle comes back. If you really go at it in a positive fashion, muscle will come back. So here's another interesting visual cross-section of mid-thigh, showing the femur here in white, and the yellow is the fat, and the red is the muscle. So this is an 88-year-old fit and walking, and here we have a 90-year-old who's confined to a wheelchair. And so look what happens. The muscle just disappears here when there's activity. Even at 88 years of age, plenty of muscle. That's what you need. That's what you're trying to achieve. Next topic, Centrum and vitamin D. So these are two of the vitamin interventions that I use in my system. I take Centrum on a daily basis, and I make sure my vitamin D level is up in the mid-upper range. Vitamin D ranges from about 50 to 200, and I always make sure that my levels are up by doing perhaps blood tests every 6 months. I take supplements of vitamin D, and I think vitamin D is a very important vitamin to have in our systems. Similarly, this paper on Centrum, I came across this a year or so ago, and I added Centrum to my protocol, my portfolio, which just shows very nicely that supplementation with Centrum has an effect on cognitive function, which again shows translates into a 60% slowing of cognitive decline from doing such a simple thing as taking a multivit once a day, which I again think is safe and simple. So it's both of these are in my toolbox. So here we are. Next topic is sunshine and infrared sauna. So here we have the solar spectrum, and at one end we've got the ultraviolet light, and the other end we've got the infrared light, and you see these numbers here. They talk about the nanometers, the wavelength. The ultraviolet light is the area that causes, that we're trying to avoid to try and cut down on risks of skin cancer. And that is our visible light spectrum. However, I think we may have got the message not completely right about avoiding sunshine, because there's a very important effect happens here with what we call near infrared, this area of infrared from this part of the spectrum. And recently, we're starting to discover some of its positive effects on the body. So perhaps the science isn't in yet, but we may have overdone the avoidance of sunshine. So sunshine and infrared. So the penetrative nature of infrared and its effect on the mitochondria, which are the powerhouse of the cells or the batteries of the cell. So recently it's been discovered that infrared light, as I showed you in the earlier slide, which is about 790 to 900 nanometers, that actually penetrates your body for up to 8 centimeters. And we're now realizing that that penetration activates the mitochondria and hits the mitochondria, the wavelengths of infrared, and activates the release of a substance called melatonin. And melatonin acts almost as a coolant. So if you take the analogy of the mitochondria like being engines in your cells. So different cells have different numbers of mitochondria. A heart cell, which is highly actioning cell, would have 2,000 to 3,000 mitochondria per cell, whereas a skin cell might have 200. So what we're spotting is that infrared radiation, which you get, can penetrate your clothes. So you can just go for a walk in the sunshine or go walking in clear sky in green areas. You're getting hit by infrared, which is penetrating your clothes, getting to your mitochondria, and giving them a very positive effect. This is what we realize now, that in the old days that sunshine was spotted as something that was helpful for healing in the TB sanatorium, and people were placed in the sunshine whenever possible. So the sun has many other benefits other than generating vitamin D. And so I think that's quite an important thing to consider. Lots of research and lots of information on the internet on this. And again, in our references at the end of this talk, you can pick up on that. So here we have that picture of the beds out in the sanatorium grabbing the sun as best they can. And that again is proof of what happened. Again, of course, the science is catching up 100 years later as to why this was a good thing. The other discussion is about infrared is the infrared sauna, which I personally have in my system as well. And in Brazil, I'm lucky to have access to an infrared sauna, which I think is also a great healing device for a variety of different reasons. Lots of research has been done on this in Finland over the years, and proving that a daily sauna, or at least 3 to 4 times a week, can be a very helpful thing on a variety of levels. Sleep hygiene, very important topic. So this is also a very important topic, something that I put a lot of effort into. For example, I sleep in a completely blacked out room. There's an interesting trick that on waking in the morning, it's important to try and get a blast of daylight into your eyes as soon as you wake up. You just open the curtains and get a good blast of blue sky if you can see it, or any light of any sort, ideally not through glass. That helps wake up your brain and turns off the melatonin function. If you do it every day, regularly, that has a good helps well on waking up. Of course, room temperature is important. So as your body temperature drops as you fall asleep, so it's maintaining the room temperature correctly. And of course, sleeping in a warm room is harder. Caffeine and alcohol. And that's, for some people it helps, and for some people it doesn't help. Me personally, I'm caffeine sensitive. I avoid caffeine completely. And I think that is, in my case, I'm caffeine sensitive. And how do you know if you're caffeine sensitive? Well, those people who stop caffeine and get a headache, they're caffeine sensitive. And caffeine can affect migraines and sleep, etc., etc. So if anyone wants to sort of clean up their sleep act, get rid of the caffeine for sure. Magnesium supplementation can be helpful in the evenings for some people. Melatonin supplementation, there's lots of information on that. Seems to work for some, seems to work for others. Not one that I use a lot myself, but will do on occasion. But my current favorite is glycine. Glycine is an amino acid. I've added this to my supplementation schedule over the last 4 months. It's very safe and simple. There's a lot of research, good research on glycine and sleep. So a teaspoon of glycine per night, I think, definitely helps give someone a deeper sleep. And of course, this slide classically shows what most of us already know. If you read a book, it's better before you go to sleep than to read your iPhone or whatever. And this is lovely research showing us that the light-emitting e-readers negatively affect sleep and next morning alertness. And here we have it all out on the slide for us. So the irradiance of an e-book versus the irradiance of a print book. There's zero from a regular book, and look what happens with your iPhones and e-readers, etc., etc. We all know this, but it's something I work hard on reading book, and I think that really helps part of sleep and optimizing everything. And last but not least, stress and relationships. So the importance of relationships is really emerging, be it in community, family, etc., especially again as we age. Making contact and maintaining contact is vital. It's a no-brainer, but sometimes it takes effort and recognition. Loneliness is a big deal, especially as we age again, and all of us need to be aware of this and making more and more attempts to connect. So plenty of scientific evidence showing us that maintaining good relationships with friends and family is an essential component of a health span improvement. Friendship, optimism, laughter. We all know that laughter is a great remedy, and kindness also help. And again, lots of interesting research on these, especially on optimism, on longevity and kindness. So these findings indicate that the influence of social relationships on the risk of death are comparable with well-established risk factors such as smoking and alcohol consumption and excess is influence of other risk factors such as physical inactivity and obesity. So a very important area for us all to work on continually as best we can. So just to prove that I have them in my office, here we are. Here's my, oh, there we go. There's my office weights. And the other little item that I like to use here is the grip strength. There we go. Grip strength is there. Perhaps the camera. There we go. And so a grip strength is quite a simple thing. But I really like this because I measure my grip strength perhaps every week. So I watch the graph of all the improvement. So just to sum it all up, what's in my toolkit as such. And here we have the weighing scales, of course. That's an easy one. Blood pressure cuff. Nowadays you can just buy them online, and always worth doing for anyone over 50, keeping an eye on knowing what your blood pressure is all about. Grip strength, as I've already spoken about, mine has improved definitely on my Katsu training. The Imuna balls are something else that this is about massage, etc. I tend to use them quite a bit. Here again, I just have a little picture about the Katsu, which is that blood flow restriction we discussed earlier on, and fascinating new topic, and of course the office weights. So I do a little bit of all of these things, and that really is what's going on in my toolkit. So my HealthSpan investment portfolio 2023 currently contains, on the sleep side, we're using good deep sleep, hopefully, glycine and being decaffeinated, which I have been for many years. But glycine is a new item I've introduced about 3 months ago, and I'm finding it very interesting, very helpful, and safe and simple. Centrum, as I said, one daily multivit, and always keeping an eye on one's vitamin D level, perhaps at least once a year to have a blood test to figure out where you are in the range. Sunshine and forest green space walking when possible, and that brings you into contact with infrared, which we now realize is a very helpful support for your mitochondria. I do Katsu roughly 15 minutes twice a day, perhaps 5 days a week. I would normally do 15 minutes around breakfast time, and then at lunchtime I'll do another 15 minutes, and I'm finding that really interesting. I think that's very exciting stuff. Katsu, blood flow restriction. I feel it has a huge benefit for the over 45s. Fasting, of course, every 6 months, and as I said before, I'm very privileged to be able to do this in Brazil, South America, in our little place down there. And that's something I shall absolutely continue to do. I do Pilates / gyrotonic class once a week. Again, I find that very helpful. I always try and do an after dinner walk. I think the classic time is about 40 minutes after you've had your food, because that's when the glucose is coming into your bloodstream, and that's when you want to get your muscles to grab that glucose to bring down your insulin resistance. cycling daily as normal, and roughly hoping to get 5 to 10,000 steps a day. Relationships, as always, this is a work in continual progress. So this, as I say, is what I'm doing in 2023, and this is a work in progress. Things may change next year as more evidence, more research comes on board. I'm currently looking at taurine. That seems like an interesting amino acid. I'm getting interested in amino acid replacement, especially as we age, because it appears that we're not as good at absorbing amino acids as we get into our 50s, 60s, and 70s. So that would be another area I'm keeping an eye on. So I hope you found this talk helpful and stimulating, and hopefully incites you to make some investments in your own hip and make sure that you get a third hip going in your system. These are two of my old quotes, which I like to say is any movement is better than no movement at all. So let's all keep moving as best we can. And any fasting is better than no fasting at all. Again, the caveat, as long as you don't have an eating disorder. So to put a sense of fun and tongue-in-cheek into this endeavor of improving one's health span, I've come up with this concept of the Wellionaires Club. I've got an online webpage with free access for the over 45s. Think about it. No Facebook, no Instagram, none of that other stuff. Just straightforward information that I just put up. I don't need your email. You don't have to have a password. It's straightforward. And I just like to use this, as I say, a bit tongue-in-cheek. There's an interesting diet there that I use for deflammation called the Welly. And there's other little tips and ideas called Wellians. So we're just having fun with this. And as Frank Sinatra always wanted to sing, but he never got the chance, was who wants to be a Wellionaire? And I certainly know that I do.